Several questions. One might seem a little basic to begin with, but I think it's one that is on the minds of a lot of people, and that's simply, what is ONDCP's role in fighting the opioid abuse epidemic?
Sure. So one of the functions of the Office of National Drug Control Policy is to really look at key strategic priorities for the administration and to develop strategies to address those issues. And, since the beginning of this administration and since our first strategy in 2010, we identified the opioid epidemic as a significant concern and really looking at federal agency actions. We followed that up in 2011 with a comprehensive plan to address at that point, which was largely a prescription drug abuse epidemic, and really focusing on 4 key areas that we felt like the administration could make progress, and it had specific action items to address it. Clearly this epidemic has changed, and while we've made some progress on it, we know that heroin has become a major problem as it relates to opioid abuse, and continue to focus on kind of intergovernmental strategies to address those issues.
Opioid abuse, heroin abuse in particular, is something that we've historically thought of as a much more urban problem. We're seeing a lot of problems in rural areas now. To what do you attribute that?
Sure. I think, while we have seen opiate abuse, and particularly heroin use, in many of our urban communities for many, many years, I think that the issue as it relates to rural communities can be attributed to a number of things. And one, we see the magnitude of the prescription drug use really being driven by the overprescribing of prescription medication across the United States. And so now we are prescribing enough prescription medication to give every adult American a bottle of pain pills. And that in some respects has been exacerbated in many rural parts of the country. And so we've seen a variability in terms of that prescribing behavior. And that is one of the reasons why we've seen kind of the explosion of the opioid epidemic beyond just our urban communities. And the other side is really looking at heroin in many, many of our communities where historically we haven't seen the trafficking and distribution of heroin. So, we know that we are seeing significant increases in heroin availability in parts of the country where historically we haven't seen it before. So it's really this kind of twofold issue around both the prescription drug abuse epidemic and the heroin epidemic. We know that about 4/5 of newer users to heroin started by misusing prescription pain medication. So, this is really an epidemic that has 2 dimensions to it, but really has its foundation in prescription drug misuse issues. Rural parts of the United States, many of them have lacked some of the health and particularly the treatment infrastructure that exists in other parts of the United States, and particularly in our urban communities. So one of our goals is to look at how do we continue to increase prevention efforts at the rural and local level, but also build on our treatment infrastructure to make sure that people in those communities have access to good evidence-based treatment.
Okay. What are some of the federal resources that are available to communities, counties in particular?
I've been very pleased in terms of the administration's response to continue to focus and ensure that local communities, states and local communities, have additional resources to battle the opioid epidemic. And on the public health side, there are a number of federal resources that support prevention programs. So our office administers, it's called the Drug-Free Communities Program, and these are locally based, locally driven programs to look at implementing community-based prevention programs. We have those programs in about 700 communities in our states, and clearly we want to make sure that we're aligning those programs with some of the most significantly impacted parts of the country. One of the biggest sources of treatment funding is through Health and Human Services. It's called the Substance Abuse Prevention and Treatment Block Grant. And these are formulas that go out to every state to look at supporting a whole host of prevention and treatment related services at the state and local level. And clearly states have an obligation to look at how they are aligning those resources with significantly impacted communities and parts of the country. You know, I'm also happy to say that just this past summer, Health and Human Services announced $100 million to support our community health centers, because we know that many parts of the country, and particularly rural parts of the country, might not have access to a substance abuse treatment program, but have a community health center. And that's a really good opportunity to look at how do we increase access, particularly in those parts of the country that haven't had access to treatment. You know, the other pieces that we can't understate is the role that the Affordable Care Act plays. So we know that many people are not able to access treatment because they haven't had insurance coverage before. And the Affordable Care Act mandates that those marketplace plans, Medicaid expansion plans, have a dedicated substance use treatment benefit to it. So, you know, clearly, you know, we have opportunities here to not only expand coverage for treatment, but to really expand our treatment infrastructure into parts of the country that we know are impacted, but that haven't had access to those kinds of programs before. You know, the president actually just announced as part of his FY17 budget proposal over $1 billion in new money to support states in their efforts to expand treatment, because we know, despite all of the things that we've done, that we have a very large gap for people who have an opioid use disorder, who need treatment and getting it. So these state-based grants will really focus on narrowing and closing that treatment gap.
Okay. So really, the approach that's being taken right now seems to be more of, again, you were saying money for treatment, treating addiction like a disease and not like a crime.
Correct. You know, I think we've learned a fair amount over the past 20 years that we've been doing this work. And, you know, I think we know that while law enforcement has a key role to play in keeping our community safe and keeping drugs out of the community, that fundamentally this is a public health related issue, and it doesn't do any good. And quite honestly, has had a disproportionate impact on many communities by those kinds of punitive approaches. So we know arrest and incarceration are largely unsuccessful in terms of really treating the disease of addiction. So we clearly want to make sure that people have access to good prevention and good treatment services. And, you know, one of the refreshing things that I've seen as I've traveled the country is the response by local law enforcement, really understanding that we can't arrest and incarcerate our way out of the problem, and are really looking at ways to divert people away from the criminal justice system. And it's something that we've been promoting as part of our overall drug strategy. And it's really great to hear that echoed at the local level, to be able to do that. But clearly, this is also an issue for local law enforcement. As I said, you know, we've had heroin in many parts of the country where we haven't seen it before. So reducing the supply of heroin in our communities becomes an equally important strategy for us. But, you know, part of what we've been trying to promote here is a balanced strategy with both public health and law enforcement. And, you know, I'm happy to say that for the first time in the history of our office, with the president's FY17 budget, we actually have a balanced budget in terms of demand reduction strategies, those public health approaches, as well as our supply reduction strategies.
As you travel the country, what are you hearing from average Americans, not just the officials that you speak with? Are you hearing from average Americans about who are concerned about the problem, or perhaps have suffered some of these problems?
We are, and, you know, it's really heartbreaking to hear the stories of people, particularly parents, who've been affected by this epidemic, and, you know, to hear the pain and anguish that they go through in terms of how it's affected their children and their communities. That, you know, those are stories that we take to heart, and that we listen to. And the other piece about this that is really striking to me is how personal this is with everybody. It's hard to find someone who hasn't been impacted by addiction in general, but particularly by this epidemic. I think everyone, you know, that I talk to knows someone who's been impacted, and it's impacted every component of the community. So, certainly our parents and law enforcement folks, but it's impacted our public health champions, and it's part of the response that I think we've been encouraging is this kind of getting every sector of the community together to really focus on a comprehensive response to that. But it is really, part of what we do is really reach out to communities to kind of hear from them in terms of what they're doing. But also, I think it's important for us to hear some of the innovative solutions that are coming out of communities as they address these kinds of issues.
Any examples of some of those kinds of things that you are aware of or have heard of in communities?
Sure. So one of the ones that became important to us, and I think has exploded across the country, is the use of this great overdose reversal drug called naloxone. It started in some of our communities in the early 2000s, and in 2010, the Quincy Police Department was the first police department in the country to carry naloxone. And since then, we have just seen it explode across the country in terms of law enforcement and other first responders taking it on, and other bystanders. We now have about 46 states that have passed some level of legislation to allow for the distribution of these, the distribution of naloxone. So I think it's a really good example of how something can happen at the local level, and then through our office, we can amplify it, put it as part of our strategy, kind of work it as a strategic priority, and just see it taking off across the country. I think the other issue that we've heard is people's experience around being prescribed, and largely inappropriately prescribed, prescription pain medications, either getting it when they didn't want them, getting them in higher quantities than they needed from them, how it gets diverted from medicine cabinets. And we take that information and really look at how do we then create better responses to it. So one of the areas that we've continued to focus on is prescriber education, making sure that every prescriber has at least some minimal amount of education as it relates to safe opioid prescribing. So, I think those are two examples of how we hear things in the community, or how we hear examples of programs that can really help us address this issue. One of the things that we've been focusing on, again, is how do we provide treatment to parts of the country that haven't historically had access. And a number of states, I think, have really developed some innovative models to do that. Vermont has been doing this. It's called this hub and spoke model. West Virginia is doing an interesting work around telehealth and doing virtual counseling across secure internet portals, and part of that has been an attempt to really push treatment and access to care in parts of the country. So it's really important for me to be out there and to hear some of these models, so that we can hopefully see replication across the country.
Pardon me. Of the money that's being proposed in the president's budget that will be used to address treatment, from what I've read, I've seen a lot about states, a lot about money going to the states. How will local governments be able to access? I mean, I don't know that it's necessarily been all worked out, but will local governments like counties be able to access those funds?
Yeah, our hope is that states will use the money wisely and judiciously, and make sure that they target the money at communities and at parts of their state that have been significantly impacted by this. So, again, while, our first goal is to get the money to be able to do it, and then work with states in terms of what we think are kind of good, prudent criteria to be able to utilize those funds, and particularly making sure that the money gets to those communities that have been significantly impacted to that. So, as this evolves, as we continue to develop the grant criteria for it, I think it'll be important for us to look at how do we make sure that states are using this money wisely to really close the treatment gap, and to close the gap particularly for people who historically have not had access to treatment.
Okay. Aside from things like naloxone, What constitutes medication-assisted treatment?
Sure.
What are some of the other aspects of that?
One of the areas, if there's been any sort of bright spot in this epidemic, is that we now have 3 medications that have been approved by the Food and Drug Administration for the treatment of people with opioid use disorders: methadone, buprenorphine, and naltrexone. And but the issue for us is, we have not seen the utilization of these medications to the extent that we think need to happen for this epidemic. When you look at good treatment outcomes, people with opioid use disorders do far better on a medication, along with counseling and other recovery supports, than they do without being on these medications. So the evidence is pretty clear that for people with opioid use disorders, having medication as part of their treatment is really important. But we know for those medications to be successful, that people still need access and need to have good counseling, other recovery supports to be able to do it. So this is not about just medications alone. You really need all the behavioral and recovery supports that go along with it to be effective. So that's part of our goal here, is to ensure that we're not just dispensing these medications, but that people are getting good comprehensive care along with those medications, because that's what appears to be really successful, is not only the medications themselves, but making sure that people are getting counseling, that they're getting some level of recovery support. We know many people need access to good jobs and stable housing as a result of their addiction. So, we want to make sure that people have the full continuum of care, including medications, to treat this issue.
What are some of the federal agencies through which whatever funding is approved will flow? Health and Human Services, DEA.
Mm-hmm. So when you look at, obviously the vast majority of our kind of funding that go for prevention, treatment, and recovery comes from our Health and Human Services Department, and chiefly through our Substance Abuse and Mental Health Services Administration. And so the $1 billion will go through SAMHSA to states who submit good applications to be able to do it. But again, this is kind of a whole of government effort. So we know funding from most of our Health and Human Services agencies become important. So our Health Resources Services Administration becomes really important in terms of our work with community health centers and other areas. But we're also working with the Department of Justice and their components, since we know law enforcement response is important, but also how we think of those who are coming in contact with our criminal justice system are important. So things like Second Chance Act grants, residential substance use treatment for houses of correction become important. So this is really, there are a wide variety of federal funding sources for both prevention and treatment opportunities, but also to work hand in hand with law enforcement as well. It becomes important for the work that we're doing.
This proposal, the president's proposal, how do you think it will fare in Congress? I mean, this has become a very bipartisan issue in many ways, because it touches so many people.
Mm-hmm. Again, from an overall perspective, this has been a bipartisan issue, and there's been a tremendous amount of interest and leadership across the aisle in Congress as it relates to not only the administration's response, but perhaps legislative initiatives to be able to deal with the issue. We saw with the president's budget proposal a tremendous amount of favorable response from both Democrats and Republicans as it relates to this issue. Again, I've traveled the country with many leaders in Congress and many representatives in Congress. And one of the biggest things that we've heard time and time again, and is supported by the data, is the number of people who need treatment who aren't able to get it. And again, I think, our efforts to really focus these resources to make sure that they're going out to states who have been impacted by this become really important. So we've got a tremendous amount of support in Congress, I think, for continuing our efforts and our response to this issue, and got a very, very good response from many members of Congress to the president's budget proposal.
In terms of dealing with this problem, the opioid abuse problem. To what extent is education a part of the formula, including an education about this not being a moral failing of people, but rather being an illness?
Yep. So changing the conversation and changing the way we think about people with addiction and with substance use disorders is really an important part of the work that we do. You know, when you look at the reasons that people cite why they don't go to treatment, that stigma still represents a significant portion of people who know they have a problem, but they're ashamed to ask for help because they do think that they will be labeled as failures of having weak will. So we know we need to change the conversation about how we view people with addictive disorders, because we know that stigma really delays people from seeking care. It inhibits people from seeking care. One of the things that we're working on with our federal agencies and with the community is changing our language around addiction. So we know, from lots of different parts of our society that language can play a key role in how we view people and how we view ourselves. And, the language of addiction, unfortunately, can oftentimes perpetuate that stigma. So when we use words like addict and junkie and substance abuser, those become highly stigmatized words, and we know that they have a direct impact in terms of, again, how we think about what people with addiction need and deserve and what people think themselves who are addicted around this issue. So, there's been studies that have shown, when we use certain words, that it elicits a more punitive response as opposed to therapeutic response. So, one of the things that we're trying to do, along with many things, to really diminish that stigma is to change the language of the field. And we have, great partners in the broader community who are working with us to change the language of addiction to reflect a non-judgmental therapeutic response to people with addictive disorders.
One question that comes to mind related to that, I've heard, and this may be apocryphal, but that there are people who have been saved with naloxone injections, not really injections, I guess it goes up the nose, whatever. That there are people who have repeatedly, perhaps 5, 6, 7, 8, 10 times, been revived from the brink of an OD. Where do you draw the line, if there is a line to be drawn?
I'm not sure there's a line to be drawn here. And, clearly, we want people who go through an overdose to get care. And we've been focusing on, again, some innovative work that's been happening in the community to move people from overdose to treatment. But, the hallmark of addiction is that you continue the same behavior in spite of really negative consequences. And that can mean overdose for some people. And I know it's hard for people to understand, but sometimes an overdose is not enough, quite honestly, to motivate people to seek care. So we need to be able to do that. From my perspective, I also kind of know from other work that, sometimes for people to quit smoking, it takes 8 or 9 or 10 quit attempts for them to be able to do it. And addiction is no different, that sometimes people need multiple tries and attempts to get care before they're able to do it. The whole point of naloxone is saving someone's life so that they can get care and treatment. And sometimes that might mean repeated administrations to be able to do that. So I'm not sure there is a line that we need to draw in terms of how many times we save someone's life to do that. I also say, with other diseases, we would not, fail to revive someone who's had a heart attack and needs, resuscitation. We wouldn't, even if it was 7 or 8 or 9 times, we wouldn't say, well, I'm sorry, you're done. You don't get any more chances at that. Clearly we want to use that as an opportunity to get people into care and treatment. But we also know we need to continue to save their lives. And, if you reduce it down to the personal level, it's someone's kid. it's someone's husband, and if that were your kid, I think you would want, that person to be saved, even if it's their eighth or ninth reversal.
Okay. And lastly is simply whether you have anything you'd like to add that we haven't, that I haven't raised.
One of the things that I think has been important, and I hear reflected back to me, is that every sector of our community has a role to play in this issue. And, we know that our federal resources and our federal response is important, but what happens at the state and local level is equally as important to the work that we're doing. And that there's lots of opportunities at the local level to really look at things like safe disposal of our programs, of looking at and working with law enforcement to be able to do it, working with our faith communities who have a huge role to play in this and have really stepped forward and say, we want to help on this. So part of our work is how do we make sure that we're working with state and local and county governments and our stakeholders to make sure that we are implementing good responses, and that we are bringing everybody together to really come to a common agreement in terms of those strategies. And I am really kind of glad when I see that sort of community involvement happening at a local level. It really is critical for the work that we do to make sure that not only are we getting the resources out, but that we are bringing together all sectors of the community, because we know that they each have a key role to play.